Medical Assistant Exam Study Guide. Question 1. In an infection control audit, office supplies are consistently running out before the next order date. Which administrative action is best? Option A. Wait until every item is completely gone. Option B. Order random supplies without reviewing use. Option C. Track usage and adjust par levels according to office needs. Option D. Hide supplies from the provider. The correct answer is option C. Track usage and adjust par levels according to office needs. Inventory control uses usage patterns and reorder points to prevent shortages. Waiting can interrupt patient care and office workflow. Unplanned ordering can waste money and storage space. Hiding supplies does not solve inventory management. Question 2. Before the visit continues in a busy front office, a patient is suspected of having tuberculosis. Which type of precautions is most appropriate? Option A. Airborne precautions. Option B. Reverse isolation for staff protection only. Option C. Contact precautions only. Option D. Droplet precautions only. The correct answer is option A. Airborne precautions. Tuberculosis can spread through airborne particles and requires airborne precautions with appropriate respiratory protection. Reverse isolation protects immunocompromised patients rather than controlling tuberculosis spread. Contact precautions focus on direct or indirect touch transmission and are not enough for tuberculosis. Droplet precautions do not address smaller airborne particles that can remain suspended. Question 3. During a pediatric clinic, a laboratory result is critical and the protocol requires immediate notification. Which action should the assistant take? Option A. Discard the result because it is abnormal. Option B. File the result for review at the end of the month. Option C. Notify the provider or designated clinical staff promptly. Option D. Tell the patient the exact diagnosis without provider review. The correct answer is option C. Notify the provider or designated clinical staff promptly. Critical results require rapid communication so the care team can respond. Abnormal results must be reported, not discarded. Delaying a critical result can put the patient at risk. Diagnosis and interpretation belong to the provider. Question 4. At the start of care in an exam room, a patient has a minor nosebleed while waiting. Which first aid instruction is commonly appropriate? Option A. Pack the nose with contaminated gauze. Option B. Tilt the head far backward. Option C. Sit upright and lean slightly forward. Option D. Lie flat immediately without assessment. The correct answer is option C. Sit upright and lean slightly forward. Leaning forward helps reduce swallowing blood while upright posture can reduce pressure. Contaminated materials should not be inserted into the nose. Tilting backward can cause blood to drain into the throat. Lying flat can increase swallowing of blood and is not the usual first step for a simple nosebleed. Question 5. To protect safety in a specialty referral visit, a child needs a height and weight recorded for medication dosing. Which documentation practice is safest? Option A. Record height only because weight changes often. Option B. Use the parent's estimate if the scale is nearby. Option C. Record the measurements using the unit required by the office protocol. Option D. Round weight to the nearest 10 pounds. The correct answer is option C. Record the measurements using the unit required by the office protocol. Accurate units are essential because dosing and growth assessment can depend on precise measurements. Both height and weight may be needed for clinical assessment. Estimated weight is less reliable than a measured value. Large rounding errors can create unsafe dose calculations. Question 6. While working in a telephone triage workflow, the prefix hyper appears in a term such as hyperglycemia. Which meaning is correct? Option A. Above normal or excessive. Option B. Below normal. Option C. Around. Option D. Between. The correct answer is option A. Above normal or excessive. Hyper means excessive or above normal, as in high blood glucose. Below normal is indicated by hypo. Around is indicated by peri. Between is indicated by inter. Question 7. During an electronic health record review, blood spills on an exam room floor. Which response follows standard safety practice? Option A. Cover the spill with an exam table paper. Option B. Ask a patient to avoid stepping on it. Option C. Use appropriate personal protective equipment and an approved disinfectant. Option D. Wipe the spill with a dry paper towel only. The correct answer is option C. Use appropriate personal protective equipment and an approved disinfectant. Blood spills require barrier protection and a disinfectant suitable for bloodborne pathogen cleanup. Covering a spill does not remove or disinfect the hazard. Patients should not be involved in hazardous cleanup. Dry wiping can spread contamination and does not disinfect the surface. Question 8. A medical assistant is working in a cardiology practice when an exam room was used for a patient with a draining wound. Which step should be completed before the next patient enters? Option A. Spray disinfectant and wipe it off immediately every time. Option B. Clean and disinfect touched surfaces according to office protocol. Option C. Open the door to air out the room only. Option D. Change only the paper on the exam table. The correct answer is option B. Clean and disinfect touched surfaces according to office protocol. Environmental cleaning reduces the chance of transferring microorganisms between patients. Disinfectants usually require the manufacturer's contact time to work properly. Ventilation alone does not remove organisms from contaminated surfaces. The exam table paper does not address other touched surfaces. Question 9. Given the workflow in a quality control review, a patient receives a document explaining what the insurer paid and what may be owed. Which document is this? Option A. Explanation of benefits. Option B. The advance directive. Option C. The progress note. Option D. Sterilization log. The correct answer is option A. Explanation of benefits. An explanation of benefits summarizes payer processing, allowed amounts, payments, and patient responsibility. An advance directive communicates future care wishes, not payment information. A progress note documents clinical care, not insurance payment decisions. A sterilization log tracks instrument processing, not claim payment. Question 10. As part of exam preparation in an exam room, a chemistry panel requiring plasma is ordered and the facility uses heparin tubes. Which tube color is commonly associated? Option A. Lavender tube. Option B. Light blue tube. Option C. Gray tube. Option D. Green tube. The correct answer is option D. Green tube. Green tubes commonly contain heparin and are used for certain plasma chemistry tests. Lavender EDTA is typically used for hematology testing. Light blue citrate is used for coagulation testing. Gray tubes are often used for glucose-related testing depending on protocol. Question 11. After reviewing the situation in a patient intake station, the term bradycardia appears in the chart. Which meaning should the medical assistant recognize? Option A. Fast breathing. Option B. Slow heart rate. Option C. High blood sugar. Option D. Inflammation of the liver. The correct answer is option B. Slow heart rate. The prefix brady means slow, and cardia refers to the heart. Fast breathing is tachypnea rather than bradycardia. High blood sugar is hyperglycemia. Inflammation of the liver is hepatitis. Question 12. Following office protocol in a women's health clinic, blood flow stops during a venipuncture after the tube begins filling. Which action is most appropriate? Option A. Probe aggressively until blood returns. Option B. Gently adjust the needle position while maintaining safety. Option C. Label the empty tube as collected. Option D. Remove the tourniquet and continue filling all tubes. The correct answer is option B. Gently adjust the needle position while maintaining safety. A small adjustment may restore blood flow if the bevel is against the vein wall. Excessive probing can injure tissue and increase patient discomfort. A tube without the required specimen must not be labeled as completed. Without blood flow, the collection cannot continue effectively. Question 13. In an urgent care office, the assistant reviews where bile is stored before release into the small intestine. Which organ stores bile? Option A. Gallbladder. Option B. Pancreas. Option C. Spleen. Option D. Bladder. The correct answer is option A. Gallbladder. The gallbladder stores and concentrates bile made by the liver. The pancreas produces digestive enzymes and hormones but does not store bile. The spleen is involved in immune and blood cell functions. The urinary bladder stores urine, not bile. Question 14. While working in a pediatric clinic, a patient needs assistance transferring from a wheelchair to the exam table. Which action is safest? Option A. Leave the wheelchair unlocked for easier movement. Option B. Ask the patient to jump to the table. Option C, lock the wheelchair and use proper body mechanics with assistance as needed. Option D, pull the patient by the arms quickly. The correct answer is option C, lock the wheelchair and use proper body mechanics with assistance as needed. Locking equipment and using safe transfer technique reduces injury risk for the patient and staff. An unlocked wheelchair can roll and cause a fall. Jumping is unsafe and unrealistic for a transfer. Pulling can injure the patient and the assistant. Question 15. During a community health clinic, the term dermatology appears in a referral. Which specialty is involved? Option A, kidney. Option B, heart. Option C, the blood. Option D, skin. The correct answer is option D, skin. Dermatology is the specialty focused on skin conditions. Nephrology focuses on the kidneys. Cardiology focuses on the heart. Hematology focuses on blood and blood disorders. Question 16. At the start of care in an administrative check-in area, the medical assistant is measuring respirations after counting the pulse. Which technique helps obtain the most accurate result? Option A, count for 5 seconds and multiply by 12. Option B, record the respiratory rate from the last visit. Option C, ask the patient to breathe as deeply as possible. Option D, count respirations while the patient is unaware of the measurement. The correct answer is option D, count respirations while the patient is unaware of the measurement. Patients may change breathing patterns if they know respirations are being counted. Very short counts are often inaccurate for respirations. Current respirations must be measured during the encounter. Deep breathing changes the normal respiratory rate and effort. Question 17. To protect safety in a telephone triage workflow, the assistant uses a fire extinguisher on a small contained fire. Which acronym describes extinguisher use? Option A, HIPAA. Option B, PERLA. Option C, RICE. Option D, PASS. The correct answer is option D, PASS. PASS stands for pull, aim, squeeze, and sweep. HIPAA governs health information privacy and security. PERLA describes pupil assessment. RICE refers to rest, ice, compression, and elevation for certain injuries. Question 18. Given the workflow in a primary care office, the office schedules several patients at the start of each hour and sees them as rooms open. Which scheduling method is being used? Option A, wave scheduling. Option B, prior authorization. Option C, matrix blocking. Option D, stream scheduling. The correct answer is option A, wave scheduling. Wave scheduling brings patients in at set intervals such as the start of an hour. Prior authorization is payer approval and is not a scheduling method. Matrix blocking reserves time unavailable for patient appointments. Stream scheduling assigns patients specific individual appointment times. Question 19. Given the workflow in an urgent care office, an electronic record uses an audit trail. What is its purpose? Option A, approve insurance claims instantly. Option B, measure blood pressure. Option C, sterilize instruments automatically. Option D, track who accessed or changed information. The correct answer is option D, track who accessed or changed information. Audit trails support accountability by recording user activity in the record. Payer claims processing is separate from record audit logs. Vital sign measurement requires clinical equipment and technique. Audit trails do not process instruments. Question 20. For a patient encounter in a quality control review, the assistant scans a signed consent form into the wrong patient's chart. Which action is best? Option A, ask the patient to sign a blank form. Option B, leave it because both patients use the same clinic. Option C, report and correct the filing error according to policy. Option D, delete the form and tell no one. The correct answer is option C, report and correct the filing error according to policy. Misfiled records can affect patient care and privacy, so they must be corrected properly. Blank forms do not correct the misfiled record and are inappropriate. Clinic use does not make one patient's document appropriate in another chart. Unreported deletion can worsen the documentation error. Question 21. As part of exam preparation in an administrative check-in area, a pulse oximeter is placed on a cold finger and the reading is inconsistent. Which action should be tried first? Option A, warm the finger or choose a better perfused site. Option B, place the probe over wet nail polish. Option C, ignore the waveform and record the lowest value. Option D. Increase oxygen without reporting the finding. The correct answer is option A. Warm the finger or choose a better perfused site. Poor peripheral perfusion can make pulse oximetry readings unreliable. Moisture and polish can interfere with sensor performance. An unstable signal should be corrected before documenting the value. Medication or oxygen changes should follow provider direction and clinical protocol. Question 22. To protect safety in an urgent care office, the provider asks the assistant to perform a task prohibited by state law. Which action is appropriate? Option A. Perform it because any provider request is automatically legal. Option B. Ask another assistant to do it secretly. Option C. Clarify the concern and follow legal scope of practice requirements. Option D. Document that the patient requested it and proceed. The correct answer is option C. Clarify the concern and follow legal scope of practice requirements. Medical assistants must follow laws, regulations, and employer policy even when working under delegation. Delegation does not make a prohibited task legal. Passing on an improper task does not resolve the legal issue. Patient request does not override scope of practice limits. Question 23. The care team in a same-day appointment asks for guidance because lead V4 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A. Fourth intercostal space at the right sternal border. Option B. Midway between V2 and V4. Option C. Fourth intercostal space at the left sternal border. Option D. Fifth intercostal space at the left midclavicular line. The correct answer is option D. Fifth intercostal space at the left midclavicular line. V4 is placed at the fifth intercostal space along the left midclavicular line. That location is used for V1. That location is used for V3 rather than V4. That location is used for V2. Question 24. As part of exam preparation in a procedure setup, a subpoena for medical records arrives at the office. Which response is best? Option A. Give it to the provider or designated privacy officer for proper handling. Option B. Ignore it because subpoenas never apply to clinics. Option C. Immediately fax the entire chart without review. Option D. Ask the receptionist to summarize the chart from memory. The correct answer is option A. Give it to the provider or designated privacy officer for proper handling. Legal requests for records should be reviewed through office policy before information is released. Subpoenas can require action and should not be ignored. Records should not be released without verifying legal requirements and scope. Summaries from memory are unreliable and not an appropriate legal response. Question 25. Before the visit continues in a busy front office, a voicemail must be left for a patient according to office policy. Which message is safest? Option A. Demand payment details with full medical history. Option B. Leave limited information and a callback number. Option C. Leave another patient's results for comparison. Option D. Describe the diagnosis in detail on the message. The correct answer is option B. Leave limited information and a callback number. Limited voicemail content reduces the risk of exposing health information to others. Excessive information violates privacy and may not be necessary. Sharing another patient's information is a privacy breach. Detailed clinical information may be heard by unauthorized people. Question 26. In a diagnostic testing area, a patient pays a fixed amount at the time of an office visit. Which insurance term applies? Option A. Premium. Option B. Adjustment. Option C. Deductible. Option D. Copayment. The correct answer is option D. Copayment. A copayment is a fixed amount the patient pays for a covered service. A premium is the amount paid to maintain insurance coverage. An adjustment changes the billed amount based on contracts or corrections. A deductible is the amount the patient pays before insurance begins paying according to the plan. Question 27. A medical assistant is working in a certification exam scenario when a wet floor is noticed near the reception desk. Which action best prevents injury? Option A. Place a warning sign and arrange cleanup immediately. Option B. Ignore it because it is not in an exam room. Option C. Cover it with loose papers. Option D. Wait until a patient reports slipping. The correct answer is option A. Place a warning sign and arrange cleanup immediately. Prompt warning and cleanup reduce slip and fall risk. Safety hazards matter throughout the facility. Loose paper can worsen slipping and does not clean the hazard. Prevention should occur before an injury happens. Question 28. At the start of care in an infection control audit, a urine culture is ordered for a patient who can void independently. Which collection method is most appropriate? Option A, random sample from an old urinal. Option B, clean catch midstream specimen. Option C, specimen collected from the toilet bowl. Option D, first drops of urine into an unclean container. The correct answer is option B, clean catch midstream specimen. A clean catch midstream specimen helps reduce contamination from skin or genital flora. Old specimens may be contaminated and may not reflect current results. Toilet water contaminates the specimen. Initial urine can carry contaminants and an unclean container is inappropriate. Question 29. An office review in a pediatric clinic shows that the P wave is reviewed on an electrocardiogram. Which event does it represent? Option A, atrial depolarization. Option B, ventricular repolarization. Option C, ventricular depolarization. Option D, kidney filtration. The correct answer is option A, atrial depolarization. The P wave represents electrical activation of the atria. Ventricular repolarization is represented by the T wave. Ventricular depolarization is represented mainly by the QRS complex. Kidney filtration is unrelated to electrocardiogram waveforms. Question 30. The care team in a cardiology practice asks for guidance because a medication order is present but the patient reports an allergy to the drug. Which action should occur before administration? Option A, administer the medication because it was ordered. Option B, hold the medication and notify the provider. Option C, ask the patient to sign a form and give it anyway. Option D, change the medication to another drug independently. The correct answer is option B, hold the medication and notify the provider. A reported allergy is a safety concern that must be clarified before giving the medication. An order does not override a possible allergy. A form does not make an unsafe medication appropriate. Medical assistants do not independently substitute medications. Question 31. Following office protocol in a pediatric clinic, a sterile dressing change is being prepared. Which action helps maintain sterility? Option A, open sterile supplies without touching the inner sterile surface. Option B, reach across the field with unsterile clothing. Option C, place sterile gauze on an unclean counter. Option D, reuse sterile gloves from a previous patient. The correct answer is option A, open sterile supplies without touching the inner sterile surface. Avoiding contact with sterile surfaces helps preserve the sterile field. Reaching over the field can contaminate it. An unclean surface contaminates sterile supplies. Sterile gloves are single-use and patient-specific. Question 32. For a patient encounter in an electronic health record review, an intradermal test is being prepared. Which description matches the route? Option A, injection into deep muscle tissue. Option B, medication swallowed by mouth. Option C, medication placed into the ear canal. Option D, injection just under the epidermis to form a small wheal. The correct answer is option D, injection just under the epidermis to form a small wheal. Intradermal injections are shallow and often create a small bleb or wheal. Deep muscle injection is intramuscular. Swallowed medication is oral administration. Ear canal administration is otic. Question 33. To protect safety in a patient education session, a patient states that the listed pharmacy is no longer used. Which action best supports accurate care coordination? Option A, delete all pharmacy information from the record. Option B, choose the pharmacy closest to the clinic. Option C, update the preferred pharmacy after verifying the new information. Option D, leave the old pharmacy because it is already in the chart. The correct answer is option C, update the preferred pharmacy after verifying the new information. Current pharmacy information helps prescriptions and refills reach the correct location. Removing needed information can interrupt prescribing workflows. The preferred pharmacy should come from the patient rather than staff convenience. Outdated demographic information can delay medication access. Question 34. For a patient encounter in an electronic health record review, the bladder of a blood pressure cuff is not centered over the brachial artery. Which issue may occur? Option A, the pulse oximeter will stop working. Option B, the oral temperature will decrease. Option C, the patient will automatically faint. Option D, the reading may be inaccurate. The correct answer is option D. The reading may be inaccurate. Proper cuff placement over the brachial artery is needed for accurate auscultation. Blood pressure cuff alignment does not control the pulse oximeter. Cuff placement does not change oral temperature. Incorrect cuff placement can be uncomfortable but does not automatically cause syncope. Question 35. To protect safety in a certification exam scenario, a package of sterile instruments has an expired sterilization date under office policy. Which action is appropriate? Option A. Open the package and rinse the instruments. Option B. Write a new date on the package. Option C. Reprocess the instruments before use. Option D. Use the instruments if the package is dry. The correct answer is option C. Reprocess the instruments before use. Expired or compromised sterile items should not be used until they are properly reprocessed. Rinsing does not restore sterility. Changing the date without reprocessing is unsafe and misleading. A dry package alone does not override an expiration policy. Question 36. After reviewing the situation in a cardiology practice, a rapid strep test requires a throat swab. Which technique is best? Option A. Swab the tonsillar area and posterior pharynx while avoiding the tongue. Option B. Swab the outside of the lips. Option C. Collect sputum from a deep cough. Option D. Touch the tongue repeatedly to collect saliva. The correct answer is option A. Swab the tonsillar area and posterior pharynx while avoiding the tongue. A proper throat specimen contacts the likely infected area without contamination from the tongue or cheeks. The lips do not provide the specimen needed for strep testing. Sputum is not the specimen used for a rapid strep throat swab. Saliva and tongue contact can dilute or contaminate the specimen. Question 37. To protect safety in a patient education session, a patient needs crutch walking education after provider instruction. Which principle is important? Option A. Crutches should be used only on wet floors. Option B. The patient should skip follow-up if pain increases. Option C. Body weight should rest mainly on the armpits. Option D. Crutches should fit properly and not press into the axilla. The correct answer is option D. Crutches should fit properly and not press into the axilla. Improper crutch fit can compress nerves and blood vessels in the axilla. Crutches are mobility aids and wet floors increase fall risk. Worsening symptoms should be reported according to instructions. Weight should be supported through the hands, not the axilla. Question 38. Following office protocol in a clinical skills review, a patient has confirmed influenza and is coughing in the waiting room. Which infection control step is most appropriate? Option A. Place the patient beside an immunocompromised patient. Option B. Use only sterile gloves without a mask. Option C. Skip precautions if the patient is already taking medication. Option D. Apply droplet precautions and offer a mask according to protocol. The correct answer is option D. Apply droplet precautions and offer a mask according to protocol. Influenza is commonly managed with droplet precautions and source control measures. Separating symptomatic patients helps reduce transmission risk. Sterile gloves do not protect mucous membranes from respiratory droplets. Treatment does not remove the need for appropriate precautions. Question 39. The care team in an exam room asks for guidance because a patient says they cannot afford a prescribed medication. Which response is best? Option A. Ignore the comment because finances are private. Option B. Notify the provider or appropriate staff so alternatives can be discussed. Option C. Tell the patient to stop all medications. Option D. Suggest sharing medication with a friend. The correct answer is option B. Notify the provider or appropriate staff so alternatives can be discussed. Cost concerns affect adherence and should be routed to the care team for appropriate options. The concern directly affects care and should be addressed respectfully. Stopping medication without provider guidance can be unsafe. Sharing prescriptions is unsafe and inappropriate. Question 40. For a patient encounter in an outpatient laboratory, a patient asks the assistant whether to stop taking a prescribed medication. Which response is appropriate? Option A. Recommend doubling the dose instead. Option B. Refer the question to the provider. Option C. Tell the patient to stop immediately. Option D. Suggest using a friend's medication. The correct answer is option B. Refer the question to the provider. Medication changes require provider guidance because stopping therapy can be unsafe. Changing a dose without provider order is unsafe and outside scope. Directing medication discontinuation is outside the assistant role. Sharing medication is unsafe and inappropriate. Question 41. Given the workflow in a primary care office, a staff member shares an electronic health record password to save time. Which risk is created? Option A, improved privacy protection. Option B, automatic insurance approval. Option C, better sterilization monitoring. Option D, loss of accountability for chart access. The correct answer is option D, loss of accountability for chart access. Unique logins support audit trails and show who accessed or changed information. Password sharing weakens privacy and security. Passwords do not control payer authorization. Login credentials do not sterilize instruments. Question 42. At the start of care in an electronic health record review, a patient is learning how to use a home blood pressure log. Which instruction improves reliability? Option A, use another person's readings if the cuff is shared. Option B, skip technique instructions because home cuffs are automatic. Option C, record readings with date, time, and relevant notes as directed. Option D, write only the highest number ever measured. The correct answer is option C, record readings with date, time, and relevant notes as directed. A structured log helps the provider compare readings and context over time. Readings must belong to the patient. Proper positioning and technique still matter with automatic cuffs. Selective recording can mislead clinical decisions. Question 43. In a treatment room, a tickler file is used in the office. Which purpose does it serve? Option A, track future follow-ups or reminders. Option B, measure oxygen saturation. Option C, sterilize instruments. Option D, draw blood into tubes. The correct answer is option A, track future follow-ups or reminders. A tickler system helps staff remember time-sensitive tasks or future actions. Oxygen saturation requires a pulse oximeter. Sterilization requires approved equipment and process. Blood collection uses phlebotomy supplies, not a reminder file. Question 44. Before the visit continues in an outpatient laboratory, a medical assistant is preparing a sterile field. Which action would contaminate the field? Option A, keeping sterile items above waist level. Option B, reaching across the sterile field with an unsterile sleeve. Option C, using sterile forceps for sterile supplies. Option D, opening the wrapper away from the body first. The correct answer is option B, reaching across the sterile field with an unsterile sleeve. Crossing a sterile field with unsterile clothing can contaminate the field. Sterile items are generally kept in view and above waist level. Sterile forceps can help maintain asepsis when used correctly. Opening the far flap first is a common way to avoid reaching over the field. Question 45. An office review in a community health clinic shows that a patient collapses in the hallway and is unresponsive. Which action should be taken first? Option A, activate emergency response and assess breathing according to training. Option B, move the patient to a chair before assessing. Option C, offer water by mouth immediately. Option D, finish documenting the previous visit. The correct answer is option A, activate emergency response and assess breathing according to training. An unresponsive patient requires immediate emergency response and basic life support actions within training. Unnecessary movement can cause injury and delay assessment. Giving oral fluids to an unresponsive patient risks aspiration. Documentation should not delay emergency care. Question 46. When a patient encounter unfolds in a medication administration visit, the term hematuria is reported on a laboratory result. Which finding does it indicate? Option A, air in the lungs. Option B, protein in the stool. Option C, sugar in the blood. Option D, blood in the urine. The correct answer is option D, blood in the urine. Hematuria means blood is present in the urine. Air in the lungs is not described by hematuria. Protein in stool is not hematuria. Sugar in the blood is described by glycemia terms. Question 47. A medical assistant is working in a same-day appointment when a patient asks why a medication is placed under the tongue. Which route is being described? Option A, sublingual. Option B, ophthalmic. Option C, topical. Option D, otic. The correct answer is option A, sublingual. Sublingual administration places medication under the tongue for absorption through oral mucosa. Ophthalmic medications are used in the eye. Topical medications are applied to the skin or surface tissues. Otic medications are placed in the ear. Question 48. Given the workflow in an exam room, a patient with diabetes is scheduled for fasting laboratory work. Which action is appropriate? Option A. Tell the patient to stop all diabetes medications without provider input. Option B. Review fasting instructions and route medication questions to the provider. Option C. Tell the patient fasting means no restrictions at all. Option D. Cancel the test because diabetes always prevents fasting labs. The correct answer is option B. Review fasting instructions and route medication questions to the provider. Fasting instructions can be reinforced, while medication adjustments require provider guidance. Medication changes can be unsafe without provider direction. Fasting usually includes specific limits on food and drink. Diabetes requires careful instructions but does not automatically cancel testing. Question 49. When a patient encounter unfolds in a quality control review, a new patient completes a health history form with several medication allergies listed. Which action should the medical assistant take next? Option A. Remove allergies that the patient says happened many years ago. Option B. Verify the allergy information and enter it clearly in the medical record. Option C. Place the form in the chart without reviewing it. Option D. Ask the patient to remember only prescription allergies. The correct answer is option B. Verify the allergy information and enter it clearly in the medical record. Medication allergies must be confirmed and documented so the care team can avoid unsafe orders. Past reactions may still be clinically important and should not be deleted without provider direction. Important safety information can be missed if the history is not reviewed. Allergies to over-the-counter drugs, foods, or latex may also affect care. Question 50. Following office protocol in an administrative check-in area, a pulmonary function test is scheduled. Which patient instruction may be relevant according to protocol? Option A. Eat a heavy meal immediately before every test. Option B. Wear tight clothing that restricts breathing. Option C. Ignore all provider instructions about inhalers. Option D. Follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. The correct answer is option D. Follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Pulmonary testing depends on patient preparation and proper effort during the test. A heavy meal may interfere with comfortable breathing for some tests. Restrictive clothing can interfere with respiratory effort. Medication instructions should follow the provider or testing protocol. Question 51. To protect safety in a certification exam scenario, a patient requests an appointment reminder by text message. Which consideration is important? Option A. Follow office policy and patient communication preferences. Option B. Text any diagnosis to any phone number in the chart. Option C. Ignore all reminder preferences. Option D. Post the reminder on social media. The correct answer is option A. Follow office policy and patient communication preferences. Electronic reminders should follow privacy policy and documented preferences. Sensitive information and wrong numbers can create privacy risk. Preferences help guide appropriate communication. Public posting would expose private information. Question 52. Given the workflow in an administrative check-in area, a medical assistant prepares to administer an injection. Which set best represents medication rights? Option A. Right color of vial and right storage shelf. Option B. Right insurance, right copay, right appointment, and right room. Option C. Right patient, right medication, right dose, right route, right time, and right documentation. Option D. Right diagnosis only. The correct answer is option C. Right patient, right medication, right dose, right route, right time, and right documentation. The medication rights are safety checks used to prevent administration errors. Vial appearance and shelf location are not sufficient medication rights. Administrative details do not replace medication safety checks. Diagnosis alone is not enough to confirm safe administration. Question 53. A medical assistant is working in an administrative check-in area when soap and water are required instead of alcohol sanitizer after caring for a patient with suspected Clostridioides difficile. Which reason explains this requirement? Option A. Soap and water help remove spores more effectively from the hands. Option B, hand washing is needed only before eating. Option C, alcohol sanitizer is always illegal in clinics. Option D, gloves completely replace hand hygiene. The correct answer is option A. Soap and water help remove spores more effectively from the hands. Certain spores are not reliably eliminated by alcohol-based hand rubs, so mechanical washing is important. Hand hygiene is required at multiple points in patient care. Alcohol-based hand rubs are appropriate for many routine situations. Gloves reduce exposure but do not replace hand hygiene after removal. Question 54. In a telephone triage workflow, a provider needs the head of the exam table raised for a patient with breathing difficulty. Which position may be helpful? Option A, prone position. Option B, lithotomy position. Option C, Fowler position. Option D, Trendelenburg is the only routine choice. The correct answer is option C, Fowler position. Fowler position raises the head and upper body, which can ease breathing for some patients. Prone places the patient face down and may worsen breathing comfort. Lithotomy is used for pelvic procedures and does not primarily support breathing. Trendelenburg lowers the head and is not the usual comfort position for breathing difficulty. Question 55. Following office protocol in a quality control review, a patient reports feeling dizzy after standing quickly. Which immediate action reduces fall risk? Option A. Ask the patient to walk faster. Option B. Leave the patient standing while searching for forms. Option C. Assist the patient to sit or lie down safely. Option D. Tell the patient dizziness is impossible. The correct answer is option C. Assist the patient to sit or lie down safely. Helping the patient into a safe position reduces the chance of injury from fainting or falling. Walking can increase fall risk when the patient is dizzy. An unsteady patient should not be left unsupported. Dismissing symptoms does not protect patient safety. Question 56. At the start of care in a women's health clinic, a prothrombin time test is ordered. Which tube should be selected? Option A, light blue tube. Option B, lavender tube. Option C, gray tube. Option D, a blood culture bottle only. The correct answer is option A, light blue tube. Coagulation tests such as prothrombin time require sodium citrate in a light blue tube. Lavender EDTA is used for hematology and can interfere with coagulation testing. Gray fluoride oxalate is not the standard additive for coagulation studies. Blood cultures detect microorganisms and are not used for prothrombin time testing. Question 57. When a patient encounter unfolds in a busy front office, the provider discusses the function of white blood cells. Which role is most accurate? Option A, store bile for digestion. Option B, produce insulin in the pancreas. Option C, carry oxygen as their primary job. Option D, help defend against infection. The correct answer is option D, help defend against infection. White blood cells are immune cells that help protect the body from infection. Bile storage is a gallbladder function. Insulin production occurs in pancreatic beta cells, not white blood cells. Oxygen transport is mainly the role of red blood cells. Question 58. Following office protocol in a telephone triage workflow, a patient with limited English proficiency arrives for a consent discussion. Which resource is most appropriate? Option A, use a qualified medical interpreter. Option B, ask a young child to interpret. Option C, skip the explanation if the patient nods. Option D, speak louder and slower in English only. The correct answer is option A, use a qualified medical interpreter. A qualified interpreter improves accuracy, confidentiality, and informed communication. Children should not be used for medical interpretation because accuracy and family dynamics are concerns. Nodding does not prove understanding or valid communication. Volume does not remove a language barrier. Question 59. When a patient encounter unfolds in a clinical skills review, a new patient calls to schedule an annual physical. Which information should be collected for registration? Option A, another patient's insurance card. Option B, only the patient's favorite pharmacy color. Option C, demographics, contact information, insurance information, and reason for visit. Option D, the assistant's diagnosis before the visit. The correct answer is option C, demographics, contact information, insurance information, and reason for visit. Complete registration information supports scheduling, billing, and clinical preparation. Insurance information must belong to the patient being registered. That information does not complete registration. The assistant should not diagnose during scheduling. Question 60. An office review in a same-day appointment shows that a medical assistant performs a procedure without patient permission. Which legal concern may apply? Option A, battery. Option B, emancipation. Option C, defamation. Option D, coordination of benefits. The correct answer is option A, battery. Battery can involve intentional touching or treatment without consent. Emancipation relates to a minor's legal independence. Defamation involves false statements that harm reputation. Coordination of benefits is an insurance concept. Question 61. As part of exam preparation in a pediatric clinic, a patient has an advance directive in the chart. Which statement is most accurate? Option A. It allows the assistant to ignore provider orders. Option B. It is used only to schedule appointments. Option C. It communicates the patient's wishes about future medical care. Option D. It replaces all insurance forms. The correct answer is option C. It communicates the patient's wishes about future medical care. An advance directive helps guide care decisions if the patient cannot speak for themselves. Care decisions still follow legal, clinical, and facility processes. Scheduling is unrelated to the purpose of an advance directive. Advance directives do not replace billing or insurance documents. Question 62. Before the visit continues in an administrative check-in area, the assistant teaches a patient how to prepare for a fasting laboratory test. Which method best confirms understanding? Option A. Ask only whether the patient has any questions. Option B. Give instructions as quickly as possible. Option C. Ask the patient to explain the instructions back in their own words. Option D. Use medical jargon to sound professional. The correct answer is option C. Ask the patient to explain the instructions back in their own words. Teach back checks whether the patient understood the instructions and allows correction of misunderstandings. Patients may say no even when they misunderstand instructions. Rushing can reduce comprehension. Jargon can confuse patients and reduce understanding. Question 63. A medical assistant is working in a diagnostic testing area when a centrifuge is used in the laboratory. Which safety practice is important? Option A. Stop the rotor with a hand. Option B. Open the lid while it is spinning. Option C. Balance tubes before starting the centrifuge. Option D. Place only one tube at any weight in the rotor. The correct answer is option C. Balance tubes before starting the centrifuge. Balancing tubes helps prevent vibration, breakage, and equipment damage. Stopping a rotor manually is dangerous. Opening a spinning centrifuge is unsafe. Unbalanced loads can damage the machine or specimens. Question 64. At the start of care in a preventive care visit, the provider asks for body mass index during an adult wellness visit. Which values are needed? Option A. Height and weight. Option B. Blood pressure and temperature. Option C. Pulse and respirations. Option D. Oxygen saturation and pain score. The correct answer is option A. Height and weight. Body mass index is calculated from height and weight. Blood pressure and temperature do not determine body mass index. Pulse and respirations are vital signs but are not used to calculate body mass index. Oxygen saturation and pain score provide different clinical information. Question 65. During a same-day appointment, a patient is placed lying face down for a back examination. Which position is being used? Option A. Supine. Option B. Lithotomy. Option C. Prone. Option D. Fowler. The correct answer is option C. Prone. Prone means lying on the abdomen with the face downward. Supine means lying on the back. Lithotomy involves legs in stirrups for certain pelvic procedures. Fowler is a seated or semi-seated position. Question 66. A medical assistant is working in a quality control review when the urinary system is reviewed with a student. Which organ filters blood to form urine? Option A. Kidney. Option B. Appendix. Option C. Gallbladder. Option D. Spleen. The correct answer is option A. Kidney. The kidneys filter blood, regulate fluid balance, and form urine. The appendix is associated with lymphoid tissue in the digestive tract. The gallbladder stores bile and does not form urine. The spleen filters blood cells and supports immune function but does not form urine. Question 67. The care team in a patient intake station asks for guidance because a minor arrives without a parent for a non-urgent visit. Which action is best? Option A. Assume all minors can consent to every service. Option B. Refuse all care without considering exceptions. Option C. Ask another patient in the waiting room to consent. Option D. Follow state law and office policy for consent requirements. The correct answer is option D. Follow state law and office policy for consent requirements. Consent rules for minors vary by situation and jurisdiction, so policy must be followed. Minor consent is not universal for all services. Some laws allow minors to consent for certain services. Other patients cannot provide consent for the minor. Question 68. A medical assistant is working in a clinical skills review when a capillary puncture is needed on an adult finger. Which side is generally preferred? Option A. The little finger near the bone. Option B. The center of the thumb pad. Option C. The tip of the index finger. Option D. The side of the middle or ring finger pad. The correct answer is option D. The side of the middle or ring finger pad. The lateral side of the middle or ring finger pad helps avoid bone and sensitive central tissue. The little finger has less tissue over bone and is usually avoided. The thumb is often calloused and has a pulse, making it less preferred. The index finger is commonly used for touch and may be more sensitive or calloused. Question 69. For a patient encounter in a medical office workflow, a patient from a different cultural background describes a health practice unfamiliar to the assistant. Which response is most appropriate? Option A. Refuse to document relevant information. Option B. Assume all people from that culture act the same. Option C. Tell the patient the practice is foolish. Option D. Ask respectful questions and avoid judgment. The correct answer is option D. Ask respectful questions and avoid judgment. Culturally sensitive communication explores patient beliefs while maintaining respect. Relevant patient information should be documented according to policy. Stereotyping ignores individual differences. Judgmental language damages trust and may prevent disclosure. Question 70. At the start of care in a certification exam scenario, the abbreviation PRN appears on a medication list. Which meaning should be recognized? Option A. Every morning. Option B. Immediately. Option C. By mouth. Option D. As needed. The correct answer is option D. As needed. PRN means the medication is taken as needed according to the order. Every morning is commonly abbreviated differently and is not PRN. Immediately is STAT in common medical usage. By mouth is PA. Question 71. Given the workflow in a medication administration visit, the provider requests an adult radial pulse during intake. Which technique should the medical assistant use? Option A. Place 2 or 3 fingers over the radial artery at the wrist. Option B. Count respirations before locating the pulse. Option C. Use the thumb to feel the pulse. Option D. Place the stethoscope over the abdomen. The correct answer is option A. Place 2 or 3 fingers over the radial artery at the wrist. The radial artery at the thumb side of the wrist is commonly used for an adult pulse. Respirations are measured separately and do not identify the pulse site. The thumb has its own pulse and can interfere with accurate counting. The abdomen is not used for a routine radial pulse. Question 72. As part of exam preparation in a medication administration visit, a specimen must be protected from light after collection. Which handling method is appropriate? Option A. Place the tube in direct sunlight to warm it. Option B. Shake the specimen vigorously for 1 minute. Option C. Wrap the specimen in foil or use an amber container as directed. Option D. Leave the specimen uncovered at the front desk. The correct answer is option C. Wrap the specimen in foil or use an amber container as directed. Some analytes are light sensitive and require protection immediately after collection. Sunlight can degrade light-sensitive specimens. Vigorous shaking can hemolyze blood specimens. Delayed or improper handling can compromise results. Question 73. Following office protocol in a medication administration visit, the assistant prepares a vaccine that must remain refrigerated. Which practice is safest? Option A. Store it in a desk drawer overnight. Option B. Place it in direct sunlight to warm quickly. Option C. Use it after expiration if it looks clear. Option D. Maintain required temperature storage and check expiration before use. The correct answer is option D. Maintain required temperature storage and check expiration before use. Vaccines and temperature-sensitive medications require proper storage to preserve effectiveness. Room temperature storage can damage refrigerated products. Sunlight and heat can damage the product. Appearance does not prove potency after expiration. Question 74. Following office protocol in a medication administration visit, a payer sends money with a remittance advice. What does the remittance advice explain? Option A. Where to place EKG chest leads. Option B. Which vaccine lot is expired. Option C. How to sterilize forceps. Option D. How the claim was processed and paid or denied. The correct answer is option D. How the claim was processed and paid or denied. Remittance advice provides payment, denial, adjustment, and reason information for claims. Electrocardiogram placement is unrelated to insurance remittance. Vaccine inventory is not the purpose of remittance advice. Sterilization instructions are not part of remittance advice. Question 75. When a patient encounter unfolds in a clinical skills review, an intramuscular injection is ordered for an adult. Which site may be used according to protocol? Option A. Inside a visible vein. Option B. The fingernail bed. Option C. A reddened rash site. Option D. Deltoid muscle when the medication and volume are appropriate. The correct answer is option D. Deltoid muscle when the medication and volume are appropriate. The deltoid can be used for certain adult intramuscular injections when volume and medication are suitable. A vein is used for intravenous access, not intramuscular injection. The fingernail bed is not an intramuscular injection site. Irritated or infected skin should generally be avoided. Question 76. An office review in a patient education session shows that a medical assistant discusses a patient's diagnosis in a crowded elevator. Which rule is being violated? Option A. Sterile technique. Option B. Chain of custody. Option C. Patient confidentiality. Option D. Prior authorization. The correct answer is option C. Patient confidentiality. Discussing identifiable health information in a public area can expose confidential information. Sterile technique concerns preventing contamination during procedures. Chain of custody concerns specimen handling documentation, not public conversations. Prior authorization concerns payer approval for services. Question 77. While working in a walk-in clinic, the suffix itis appears in a medical term. Which meaning is most accurate? Option A. Inflammation. Option B. Removal. Option C. Pain. Option D. Study of. The correct answer is option A. Inflammation. The suffix itis generally means inflammation. Removal is commonly indicated by the suffix ectomy. Pain is commonly indicated by the suffix algia. Study of is commonly indicated by the suffix logi. Question 78. Given the workflow in a community health clinic, a patient calls with chest pain and shortness of breath. Which scheduling action is most appropriate? Option A. Tell the patient to send an email later. Option B. Follow emergency triage protocol immediately. Option C. Schedule the patient for next month. Option D. Give a diagnosis over the phone. The correct answer is option B. Follow emergency triage protocol immediately. Potential emergency symptoms should be handled urgently according to office protocol rather than scheduled as routine. Potential emergencies require immediate action. Routine scheduling can delay care for potentially serious symptoms. Medical assistants should not diagnose the cause of symptoms. Question 79. At the start of care in a specialty referral visit, the term otitis media is listed in the assessment. Which body area is involved? Option A. Middle ear. Option B. Stomach. Option C. Kidney. Option D. Liver. The correct answer is option A. Middle ear. Otitis media refers to inflammation or infection involving the middle ear. Stomach inflammation is gastritis. Kidney inflammation is related to nephritis or pyelonephritis. Liver inflammation is hepatitis. Question 80. As part of exam preparation in an administrative check-in area, a patient appears to be choking but can cough forcefully. Which response is generally appropriate? Option A. Leave the patient alone until they stop coughing. Option B. Encourage coughing and monitor closely. Option C. Give the patient food to push it down. Option D. Perform blind finger sweeps immediately. The correct answer is option B. Encourage coughing and monitor closely. A forceful cough suggests partial airway obstruction, and coughing may clear it. The patient should be monitored because the obstruction may worsen. Food can worsen the obstruction. Blind finger sweeps can push the object deeper and are not appropriate. Question 81. During a women's health clinic, an adult patient has no pulse and an automated external defibrillator is available. Which action is appropriate within training? Option A. Wait for the provider before starting any response. Option B. Give oral medication before checking responsiveness. Option C. Use the defibrillator on a conscious patient asking questions. Option D. Begin CPR and use the automated external defibrillator as directed. The correct answer is option D. Begin CPR and use the automated external defibrillator as directed. Early CPR and defibrillation improve response to cardiac arrest when performed according to training. Delaying basic life support can reduce survival. Oral medication is unsafe when cardiac arrest is suspected. An automated external defibrillator is used for suspected cardiac arrest, not an alert patient. Question 82. The care team in an urgent care office asks for guidance because a patient wants information released to a spouse. Which documentation is usually needed? Option A. A valid authorization or permission according to office policy. Option B. A note written by the assistant after the fact. Option C. A verbal request from the spouse only. Option D. No documentation because spouses always have full access. The correct answer is option A. A valid authorization or permission according to office policy. Disclosure to another person should follow privacy rules and documented patient permission. Authorization should come from the patient or legal authority. The spouse's request alone may not authorize release. Relationship alone does not automatically grant full access to records. Question 83. To protect safety in a telephone triage workflow, the pancreas is discussed during patient education. Which hormone is associated with blood glucose regulation? Option A. Melatonin. Option B. Thyroxine. Option C. Estrogen. Option D. Insulin. The correct answer is option D. Insulin. Insulin is produced by pancreatic beta cells and helps regulate blood glucose. Melatonin is associated with sleep-wake cycles. Thyroxine is a thyroid hormone involved in metabolism. Estrogen is a reproductive hormone and is not the main pancreatic glucose hormone. Question 84. Following office protocol in a pediatric clinic, a patient is ready for venipuncture and the labels have already printed. Which identification step should be completed before collecting the specimen? Option A. Ask a family member to confirm the name only. Option B. Use the room number because it is faster. Option C. Ask the patient to state 2 identifiers and compare them with the order. Option D. Label the tube after returning to the lab. The correct answer is option C. Ask the patient to state 2 identifiers and compare them with the order. Using 2 approved identifiers before collection helps ensure the right test is performed on the right patient. A family member may be mistaken and 1 identifier is not enough for positive identification. A room number can change and is not considered a reliable patient identifier. Delayed labeling increases the risk of specimen mix-ups and rejected samples. Question 85. The care team in a treatment room asks for guidance because the term hypertension appears in the problem list. Which meaning is correct? Option A. High blood pressure. Option B. Low blood glucose. Option C. Joint inflammation. Option D. Slow breathing. The correct answer is option A. High blood pressure. Hypertension means blood pressure above the normal range or treatment threshold identified by the provider. Low blood glucose is hypoglycemia. Joint inflammation is arthritis. Slow breathing is bradypnea. Question 86. An office review in a pediatric clinic shows that a manual blood pressure cuff is too small for the patient's arm. Which result is most likely? Option A. The temperature will be elevated. Option B. The blood pressure may read falsely high. Option C. The blood pressure may read falsely low. Option D. The pulse oximetry reading will be inaccurate. The correct answer is option B. The blood pressure may read falsely high. A cuff that is too small can overestimate blood pressure because pressure is applied over too narrow an area. Cuff size has no direct effect on body temperature. A cuff that is too large is more likely to produce a falsely low reading. Cuff size does not directly determine oxygen saturation accuracy. Question 87. The care team in an infection control audit asks for guidance because a sterile package is torn before a minor procedure. Which action is required? Option A. Use the items if they look clean. Option B. Tape the wrapper and use the contents. Option C. Consider the contents contaminated and obtain a new sterile package. Option D. Spray the package with disinfectant. The correct answer is option C. Consider the contents contaminated and obtain a new sterile package. A torn wrapper breaks the sterile barrier, so the contents cannot be considered sterile. Clean appearance does not prove sterility. Taping does not restore sterility after the barrier is compromised. Surface disinfectant cannot sterilize items inside a compromised package. Question 88. After reviewing the situation in an administrative check-in area, the provider asks for an instrument to examine the ear canal. Which instrument should be prepared? Option A. Otoscope. Option B. Spirometer. Option C. Ophthalmoscope. Option D. Speculum for pelvic exam. The correct answer is option A. Otoscope. An otoscope is used to inspect the ear canal and tympanic membrane. A spirometer evaluates lung function rather than the ear. An ophthalmoscope is used to examine internal eye structures. A vaginal speculum is not used to inspect the ear canal. Question 89. After reviewing the situation in an administrative check-in area, a patient makes a complaint about care received in the office. Which response is most professional? Option A. Post the complaint online for staff opinions. Option B. Delete documentation related to the complaint. Option C. Listen respectfully and follow the office complaint process. Option D. Argue until the patient stops complaining. The correct answer is option C. Listen respectfully and follow the office complaint process. A respectful response and proper reporting support patient relations and quality improvement. Publicly sharing patient concerns can violate confidentiality. Destroying or altering records is unethical and may be illegal. Arguing escalates conflict and is unprofessional. Question 90. An office review in a community health clinic shows that a patient arrives for a routine visit and appears anxious about the first blood pressure reading. Which communication technique should the medical assistant use? Option A. Promise that the provider will not be concerned. Option B. Tell the patient the reading is probably wrong. Option C. Acknowledge the concern and explain the procedure in simple terms. Option D. Ignore the anxiety to avoid making it worse. The correct answer is option C. Acknowledge the concern and explain the procedure in simple terms. Acknowledging emotion and explaining the task supports trust while keeping the patient informed. Promising an outcome goes beyond the assistant role and may be inaccurate. Dismissing the result can reduce confidence and may be clinically misleading. Ignoring patient concerns can increase anxiety and weaken communication. Question 91. To protect safety in a procedure setup, the abbreviation NPO appears before a procedure. Which instruction does it represent? Option A. Nothing by mouth. Option B. New patient only. Option C. Normal pulse output. Option D. Nasal passage open. The correct answer is option A. Nothing by mouth. NPO means the patient should take nothing by mouth for the specified period. New patient only is not the meaning of NPO. NPO does not describe pulse measurement. NPO is not a nasal assessment abbreviation. Question 92. While working in a busy front office, a patient is left without follow-up after the provider terminates care without proper notice. Which legal issue is most likely? Option A. Abandonment. Option B. Beneficence. Option C. Assault. Option D. Coinsurance. The correct answer is option A. Abandonment. Abandonment occurs when care is ended without proper notice or an opportunity to obtain continuing care. Beneficence means acting for the patient's good. Assault is a threat or fear of unwanted touching, not failure to provide follow-up. Coinsurance is a payment-sharing insurance term. Question 93. Given the workflow in a quality control review, a disinfectant label lists a 10-minute wet contact time. Which action is necessary? Option A. Dilute the solution more to reduce odor. Option B. Keep the surface wet for the full listed contact time. Option C. Use the disinfectant only on clean hands. Option D. Wipe the surface dry immediately. The correct answer is option B. Keep the surface wet for the full listed contact time. Disinfectants need the manufacturer's required contact time to achieve the intended level of microbial kill. Unapproved dilution can reduce disinfectant strength. Environmental disinfectants are not hand hygiene products. Removing the disinfectant too soon can make it ineffective. Question 94. A medical assistant is working in a phlebotomy station when a serum sample is needed for a routine chemistry test. Which tube type may be used according to facility protocol? Option A, red or gold serum tube. Option B, light blue citrate tube for serum. Option C, gray fluoride tube for all serum tests. Option D, lavender EDTA tube for serum. The correct answer is option A, red or gold serum tube. Serum tubes allow clotting or include clot activator and separator depending on the tube. Citrate anticoagulant is used for coagulation testing. Gray tubes are not the standard serum tube for routine chemistry panels. EDTA prevents clotting and produces whole blood or plasma, not serum. Question 95. To protect safety in a procedure setup, a pain score is being collected during intake. Which approach is best? Option A, assume pain level from facial expression only. Option B, ask the patient to rate pain using the office's standard scale. Option C, change the score to match the assistant's opinion. Option D, tell the patient pain is not part of vital signs. The correct answer is option B, ask the patient to rate pain using the office's standard scale. Using a consistent pain scale helps document subjective pain in a comparable way. Facial expression alone may not reflect the patient's reported pain. The pain score should reflect the patient's report. Pain assessment is commonly included in intake workflows. Question 96. To protect safety in a telephone triage workflow, a student asks which blood component helps with clotting. Which answer is correct? Option A, platelets. Option B, neurons. Option C, alveoli. Option D, plasma glucose. The correct answer is option A, platelets. Platelets help form clots and support hemostasis. Neurons transmit nerve signals and are not blood clotting cells. Alveoli are lung structures involved in gas exchange. Glucose is a blood sugar and does not form clots. Question 97. In an outpatient laboratory, a patient asks about wound care instructions after a minor procedure. Which response is best? Option A, create new instructions that contradict the provider. Option B, avoid documenting that instructions were given. Option C, tell the patient not to call if symptoms worsen. Option D, review the provider-approved instructions and confirm understanding. The correct answer is option D, review the provider-approved instructions and confirm understanding. Medical assistants can reinforce approved instructions and use teach-back to verify understanding. Instructions should match the provider's plan and office protocol. Patient education should be documented according to policy. Patients should know when and how to seek help for concerning symptoms. Question 98. Following office protocol in a diagnostic testing area, a patient asks for a copy of their medical record. Which action should the assistant take? Option A, delete sensitive information before the request is reviewed. Option B, follow the office release of information process. Option C, give the record to anyone who asks. Option D, refuse because records belong only to the provider. The correct answer is option B, follow the office release of information process. Patients generally have rights to access their records, but the request must follow proper identity and release procedures. Altering the record is inappropriate and may violate legal requirements. Identity and authorization must be verified before disclosure. Patients have rights to access their health information under applicable rules. Question 99. Given the workflow in an infection control audit, muscle tremor artifact appears on an electrocardiogram tracing. Which intervention may improve the tracing? Option A, ask the patient to tense all muscles. Option B, remove all electrodes during the recording. Option C, help the patient relax and support the limbs. Option D, place the paper speed at 0. The correct answer is option C, help the patient relax and support the limbs. Muscle tension and movement can create artifact, so comfort and support may improve tracing quality. Tensing muscles increases electrical artifact. Electrodes are required to capture the tracing. Paper movement is needed to record the waveform. Question 100. For a patient encounter in an internal medicine office, a claim requires the code for an office visit procedure or service. Which code set is used? Option A, zip code. Option B, CPT. Option C, YCD-10CM. Option D, policy number. The correct answer is option B, CPT. CPT codes describe medical procedures and professional services. A zip code identifies location and is not a procedure code. ICD-10-CM codes describe diagnoses and reasons for services. A policy number identifies insurance coverage and does not describe the service.